Hello, good afternoon, good morning, good evening and welcome. My name's Richard, registered nurse, clinics in the UK called No More Earwax. Quick one this today, but very interesting nonetheless. This is a bit blurry to start with, that does clear out in time, so I have to get quite close to this. This lady's got quite a narrow ear, so it was quite difficult to get access. Now, I've had a quick go at that a little bit there, but because something sparked some concerns in my mind about this, but I thought let's just get the bit behind it first, which was actually the bit that was causing the problem. The obstruction wasn't huge, but as you can see, we just pull that from over the top of that, and then we'll start to see what I was concerned about. Now, I found quite a few of these recently. Good in a way that we're spotting them, but obviously we'd rather people didn't have these type of problems, whatever that problem is, because like I said in many other videos, it's not my job to diagnose what problems are. It's my job to spot potential issues and then flag them up to the relevant specialists, consultants, doctors, what have you. Now, already I'm seeing a little speck of white in the middle of there. It does glare a bit, this, at the camera. Now that happens when you can see exposed bone, which I think is what this is. So what I'm trying to do there, this is the fine end tube there. They're too delicate to go with the full size tube. Now I'm trying to suction up. There you go, a clearer view of it. You can quite clearly see the white there, can't you? And the skin's broken around the side there. I'm trying to suction up some of the dead skin that's in there, because that could well be the cause of why the skin's eroded away there and exposed the bone. So some of you regulars who watch these type of videos quite a lot, you'll know there's various reasons why this can happen. Some can do with blood supply to that particular area if it's not very good. The area can break down a little bit, or you can have something called a canal cholesteatoma, which you get a collection of dead skin. Quite rare. You can get a collection of dead skin in these little places, and then it can start to erode the bone away, erode the skin, and then infiltrate the bone to expose it. Now, I'm not sure what this is. I'm glad I found it, because obviously as soon as I saw it, I sent some of these images along with some videos and what have you to the specialist to try and get this looked at as a matter of relative urgency. But I'm going to try and clean away as much as I possibly can to make it easier for them. Now, the lady she didn't feel anything, by the way. It's quite rare that anybody does, but there's quite a big plug that I've got a good seal on something. You can hear the sound, excuse me, starting to disappear then. And that's usually a sign that you've got something that you've blocked up the tube. Now, just come away again there. So it's not going to be possible to peel away every single bit of this to expose the bone. You know, you want to make sure the patient's comfortable as you're doing something like this. And she didn't feel a thing at all. But there you go, managed to get a bit there. Now, whether that was a collection of dead skin or whether it's actually some bone that's crumbled away, I'm not entirely sure yet. So that area I've circled there, that pretty much looks like exposed bone to me, which obviously should not be there. And so hopefully we can get this lady seen as soon as possible. If I get any updates, I will let you know. But I hope you enjoyed that quick one today. But for now, take care of yourselves, and I will see you later. Bye bye.